1 in 3 people are at a risk of having kidney disease.
And in terms of referring people who have kidney disease or diabetes, how would somebody go about doing that? And are there any criteria specific for that? Or can anybody that's been diagnosed just be receive some help from you guys?
Sure. We don't have a certain stage. Clearly, people with diabetes, obviously type 1, they're born with it. Type 2, people will typically get exposed to that based on diet and kind of how their exercise type of stuff is. If there's hereditary things, but it doesn't matter what stage they're in. We like to help people who have type 2 diabetes, because oftentimes the amazing thing I have found is that with simple diet changes, oftentimes that can be reversed. Most people who come to us with kidney disease are going to be in the stage 3 or stage 4 level, sometimes even stage 5, because you don't typically get diagnosed until stage 3, because it's a pretty symptom-free disease. You don't know it's a silent disease. 1 in 3 people are at a risk of having kidney disease. They may have it and not even know it, because again, there just aren't a lot of symptoms. So unless you go and ask for that panel of blood work to be pulled to check your kidneys constantly, then you probably aren't going to know. But no, there is no stage that we will not help. Even if someone comes on and says we're pre-diabetic, we're running into issues, and we're already starting to experience some health issues. We'll take them on and help them at that point, because not always is it about going to a doctor. Sometimes we're going to be working with a couple ladies who have delivery services for food, and we'll be selling those online so people can kind of change their diets and see how that works. So improving your health can start at any stage in your life.
Oh, definitely it can. It might just take a few little changes and it can make a huge difference in your life.
And having someone to encourage you and to do that, and to know that you're not alone. We'll also offer support groups of people who are in my position, waiting to get a transplant, or they're a donor and they have questions. They want to know what's going to happen, or they're caregivers, or we simply are going to have just like a community forum where our patients can talk to each other if they so, choose to do so.